This topic is going to be about calcification. So deposition of calcium salts other than the enamel or steroids is called as hypertrophic calcification. So there are two types of calcification, namely dystrophic and metastatic calcification. Dystrophic calcification. Dystrophic calcification is characterized by deposition of calcium salts in necrotized tissues with normal calcium metabolism and calcium level in plasma. So etiology. Calcification in dead tissues may be due to caseous necrosis, liquefied necrosis, fat necrosis, gamma antibodies, thrombi, microcalcification in the breast. Where in case of calcification in degenerated tissues may be dense old scars, arthrogrypomatous plaque in aorta and coronary artery, senile dystrophy. Pathophysiology of calcification. The process of dystrophic calcification has been linked to the formation of normal hydroxyapatite, that is binding of calcium and phosphate ions, and forms precipitation of calcium phosphate. So mechanisms involved: initiation. Following necrosis, there is cell membrane damage and release of membrane phospholipids. Phosphates associated with phospholipid generates phosphate ions. Mitochondrial damage due to excessive calcium influx results in combination of calcium and phosphate ions, forms precipitate of calcium phosphate. In the stage of propagation, the structural changes in calcium and phosphate which results in propagation of deposits and forms a crystal minerals. Metastatic calcification. Metastatic calcification occurs in normal tissues and is associated with deranged calcium metabolism and hypercalcemia. The common sites involved are kidneys, lungs, stomach, blood vessels, cornea and synovium. Causes: excessive metabolism of calcium from the bone due to hyperparathyroidism, bony destructive lesions, hypercalcemia. Prolonged immobilization results in disuse, atrophy, hypercalcemia. Excessive absorption of calcium from the gut, hypervitaminosis, milk alkali syndrome, idiopathic hypercalcemia. The pathophysiology involves metastatic calcification occurs due to excessive binding of inorganic phosphate ions with elevated calcium ions. This forms precipitate of calcium phosphates. This calcification is reversible upon correction. So the gentle tabular column involves dystrophic calcifications are the deposits of calcium salts in dead and degenerated tissues. Calcium metabolism will be normal and serum calcium level will be normal. It is generally irreversible. The common causes involved are necrosis, old scars, atheromas, Mockberg sclerosis, certain tumors, cyst, calcinosis cutis. Pathogenesis involved here is increased binding of phosphates with necrotic and degenerative tissues, which in turn binds to calcium, forming the calcium phosphate precipitates. Common sites are tuberculous lymphadenitis, advanced atheromas, medial calcification of uterine arteries in multigravida, gamma antibodies in CVC spleen, etc. Metastatic calcification. So the deposits of calcium salts in normal tissues, the calcium metabolism is deranged and serum calcium level is being increased and termed as hypercalcemia. It is generally reversible upon correction of metabolic disorders. Common causes would be hyperparathyroidism and hypervitaminosis, milk alkali syndrome, hypercalcemia, etc. Pathogenesis involved here is increased precipitate of calcium phosphate due to the hypercalcemia at certain sites. Common sites involved here: basement membrane of tubules in kidney, alveolar lining in lungs, fundic mucosa of stomach, internal elastic lamina of blood vessels, and band keratopathy in carne. Thank you.